Hi everyone, hope you guys are having a great day. Today I would like to hop on to talk about the most important tip to manage osteoarthritis and specifically arthritis to the knee. So we know that the weather is getting colder and colder everywhere, and then it's usually the season that people would start to feel the after effects of arthritis. Stiffness of the joints, pain, soreness to the joint, aching of the joint. Usually coldness and humidity would really trigger that. And so this is really the season, changing of the season, starting to move into winter, colder weather. It's usually the season when we are starting to have arthritis symptoms coming in. Why is that happening? First off, let's talk about the mechanism behind osteoarthritis. It's pretty much a degeneration of the joint that happens over age. It's a normal aging process that can be considered just because we are standing, we are doing activities for a very long time. Over the time, we are starting to gradually wearing out the cartilage or the structures within the joints. So eventually the space within the joint is starting to decrease. For example, like this, two bones on either side. Usually it has a very good amount of space in between so that when you are moving, it can generate a lot of the motion. But then with arthritis or the degeneration aging happening, it's starting to lose space, it's starting to approximate. You can even see the changes on x-rays if you actually have an x-ray done. But then like I said earlier, it's a normal aging process that every one of us are gonna deal with that at some point. So is that really a problem though? Not necessarily. Like I said, everybody will have some sort of degeneration of the joint, like the normal aging process that's gonna happen. But then not everybody is suffering from arthritis or being debilitated from not able to walk, not able to stand for a long time, not able to sit for a long time, not really. It's some people are suffering that more, some people are not. So that's definitely a condition that's very manageable. And then so today I would like to share about the most important tips in order to manage that. And the tip is motion is lotion, which means when we put any active motion to the joint, we are able to somewhat reverse or slow down the process of aging or the degeneration happening to the joint. They need to be constantly pumped into this motion. If we get active motion going on, it's a constantly pumping motion happening. Just by doing that, the flow of the fluid bring in nutrients to facilitate healing, facilitate recovery. And then so that's why active motion is very important. The reason why people nowadays are very easy to develop arthritis, especially you also look at the demographics, it's happening more to people who live a more sedentary lifestyle or even a little bit more obese. It's because of that fact. They don't really put a lot of the active motion into the joints. They kind of let the joint to be stuck in the same position for a long time, and eventually the joint doesn't have enough nourishment, and then the aging process would be speed up. So with that being said, the most important thing, motion is lotion, get the active motion going. The most important thing to prevent arthritis from even happening. Speaking of this, just want to share a little bit of the fun thing I started to notice this year. So I just turned 30 years old a few months ago this year. And this is something I really noticed that I haven't noticed before. It's like starting this year because of the cold front 2 weeks ago, I actually felt a lot of soreness and stiffness in my back, and that never happened. And then I know that it wasn't related to a specific injury or a trauma or anything like that. It just crept in one morning when I woke up with it. And then when I started moving around, the stiffness, the soreness are taken away just by me actively moving it. So I know that it's aging starting to happen even though I just turned 30 years old. But with this being said, I just want to emphasize that aging, it's gonna be a process happening to every single one of us. But if you get active motion going, you are able to slow down the after effects, to even prevent those symptoms, those discomforts from happening. Like for myself, as an example, that day I realized that, so immediately when I came to the studio, I jumped on to our reformer, do some exercises, and then those stiffness just got taken away and then never came back. So a very great reminder for all of you guys. Definitely, if you are suffering from arthritis or you're starting to feel some stiffness and soreness in the joints, the most important thing you need to do is not take any supplements or medications. No, the most important thing you need to do is active range of motion, active motion to the joints, because like I said, motion is lotion. If you have any questions or concern about how to safely move the joints without really aggravating your body, then definitely would suggest to contact a licensed healthcare professional, especially a physical therapist, to evaluate your condition and then to see how you can move safely. My name is Andy Zan, physical therapist, occupational therapist, and Pilates instructor at CORE Therapy and Pilates. If you want to learn more about our approaches or how your arthritis or stiffness and pain or joints can be managed, feel free to give us a call at 512-215-4227 or visit our website therapyandpilates.com so that we can learn your condition more and help you clarify any questions you may have. That's all I have for today. I hope you guys have a great day. We will talk soon.